I see a lot of different people. Newly diagnosed, I see people with, they're coming in for follow-ups, and I see people who are acutely ill in a hospital. So I see all these people during a week. I work in a multi-specialty clinic, and I also have patients in the hospital across the street. So I do both. So I'll see the patients, 9 to 5 in the clinic and in the hospital before lunchtime or after work. I pretty much see everybody at different stages. I personally focus on women, actually people with breast cancer, because men get breast cancer too. So I focus on breast cancer, and so I see a lot of the newly diagnosed patients. So they have either been to the surgeon and I work them up, and I'm going to be the major captain for their care. So they're going to get chemotherapy, they'll get radiation therapy, and then after that we sometimes give the anti-estrogen therapies. So I manage that for the most part. Then there are a lot of people who've been through treatment and are just coming in for follow-up. And of course you have to understand, nobody likes to come to their oncologist. Okay, they don't want to go to their oncologist because everyone's afraid that, well, she's gonna find something, and my lab's gonna be normal. So people start having anxiety before coming to my visit. So even though they might be in remission, there's still a lot of underlying concern there. Their anxiety starts maybe a week to a month before coming into my visit, and I've had that discussion with them. Everybody's affected by cancer. So not only the patient, whoever the patient's living with, their spouse, their children, that person is not singled out. Cancer affects the entire family or the entire support system of that person. My first experience with NuCalm was really wonderful and fantastic. It was an incredible, pleasant experience, and which is why I got hooked on that. And then, of course, I was really curious about why it worked, because why couldn't I just put on a pair of headphones and get the same Zen like that? And I realized when I looked into the science about it, I was really fascinated. Like, there actually is incredible science behind this technique and system. So once I started, learning more about it, I actually invested into my own system. I have it and I use it every morning now, and it's been something that's been pretty useful for me. And just to share an experience, my father had died recently. I had to work full time because my partners were out on spring break, and a lot of things were happening. And I forced myself to do the NuCalm system, made sure I did it, I should say. And it gave me a forced time out of all the stress. And I have to say that it was really helpful to have those 20 minutes of just, making sure that I was in that zone. I'm not a very disciplined person to sit down and meditate. I would love to do it. I have done it. I like it, but I just don't have the discipline to do it. And so this NuCalm, I almost feel like I'm cheating. And I know I can get to that Zen zone or whatever pretty quickly now. It's been very helpful for me. And so in turn, I would like to pass it on to my patients, because obviously the patients who are dealing with cancer and going through chemotherapy and all the changes, when someone's going through chemotherapy, it would be great for them to experience, again, a forced time out from their reality. So it's something that I'm looking into with the NuCalm company, something to do for the patients. What's interesting about somebody who's dealing with a serious illness, cancer or whatever, they are under not only acute stress, fight and flight syndrome, but that they're under chronic stress. That thought doesn't really leave them. And so we know that prolonged chronic stress wears down your immune system, all of your system, to put it bluntly. And again, to alleviate some of that chronic stress, and even if, with the NuCalm system or anything that can really alleviate that, will be a benefit to them. Again, the NuCalm system is just another way of getting them into an area that we know they're going to get to with help, from the system. If I was speaking to my peers, I would tell them I found a way to cheat to get into the Zen zone. Whether or not we're talking about breast cancer, prostate cancer, lung or colon cancer, it doesn't really matter, because all of these people are undergoing the same physiological stress. And so certainly NuCalm will help anybody, and it doesn't matter the type of cancer.